Good afternoon, everyone. We'll be just a minute as we allow a few more people to join the call. All right. Good afternoon, everyone. I'm Andrew Sorensen, spokesperson here at CU Boulder. I'll be moderating today's call. Some quick housekeeping items before we get started. Today's webinar is a special session focused on vaccine safety. We're also going to be focusing on students and families, but inviting the larger campus community as well, because this is a larger topic. Next Wednesday, on Tuesday, March 9th, the campus Q&A will focus largely on faculty and staff. If you have a question for the experts on today's webinar, please use the Q&A function. You can find that at the bottom of your screen to submit a question. You can start doing that now. Please note that we are prioritizing questions today based around that subject of vaccine safety. We will do our best to get to all questions. If we do not get to your question before we reach the end of our time, you can reach us at colorado.edu/COVID-19. Our experts will answer your questions until the questions run out. If by chance we run out of questions prior to the scheduled ending of the webinar, we will end early. And as a reminder, today's call will be recorded, and that recording will be available on our COVID-19 website. On today's call, we have Provost Russell Moore, Chief Operating Officer Patrick O'Rourke, Matt McQueen, Director of Epidemiology, member of the Scientific Steering Committee of the CU Boulder Pandemic Response Office. We have Gloria Brisson, Senior Director of Medical Services, and Laura Arroyo, Director of Housing Administration at CU Boulder. She's here to answer other questions that might come up from students and families. I'll now turn it over to Pat O'Rourke, who's going to get us started with some opening comments today.
Thanks, Andrew. I really appreciate everyone who's joined us today. We've got a lot of information to share, and I'll jump right in. I'm going to share my screen in order to be able to think about where we stand with respect to COVID. And Andrew, can you confirm to me that you're seeing the PowerPoint?
Yes, you're good to go. Thank you.
That in order to be able to talk about vaccines and where we're headed, we have to talk a little bit about where we are. And currently, you can see that Boulder County itself is in level yellow on the COVID dial, but that all of the indicators are moving in positive directions. The county is at a cumulative 1-week incidence rate of 93.5 in terms of COVID cases. And where you think of where we were over the Christmas holidays and even earlier in the fall, where that was well above 200 to 300 cases per 100,000 people, it means that the number of cases has gone down dramatically, and that's great news. Similarly, the positivity rate for people who have had those PCR tests is down at around 2.4%, which is a really good number, showing us that infections are not rapidly increasing in the population. So that's really good news. On our campus situation, yesterday we had 2,200 people who took the monitoring tests on campus, which is a good number, but please, everyone who's coming to campus, make sure that you're getting your monitoring tests. That helps us to understand what's going on in the community. And that we had 4 positive test results, which is also a good number. If you remember back in the fall, we had more than 100 of our isolation spaces in campus in use. And right now we just have 4. So there's some really positive news there. Countywide, the 7-day incidence rate, you can see the graph over time, starting over just about a year ago and running through now. that the rates continue to decline. Currently, those are at 44.6 cases in terms of the 7-day average. And every time that goes down, that means that the disease is moving in the right direction within our general population. Similarly, when you break it down by age, I'm really encouraged by the fact that you can see that in almost all of the age groups that the cases are going down. But this line here that I'm tracing, ultimately ending up in the red circle, that's our 18 to 22-year-old population where we had our big spike in the fall. And that number is continuing to decline in the cases. Last week, we're down about 40% from what they were the week before. So that's great news. It means that people are, for the most part, doing what they need to do to help us be able to keep the cases under control. It's having an impact on what's happening countywide. Hospitalizations continue to decrease. That's particularly true as vaccinations begin to take hold in the population. Some of our most vulnerable populations are getting vaccinated. All of this adds up to that if we can stay on the right track and keep moving in the right direction, the yellow part is the curve showing where we are now and where we're projected to be out in the future. And you can see that those cases continue to decline as more vaccination occurs, as the population continues to take the steps that it needs to take. Now, this could change if any of the new COVID variants become more prevalent, or if we aren't diligent in how we are looking at our behaviors and what we're doing to make sure that COVID remains well controlled within the county and in the state, but it's headed in the right direction. I will say, though, that we are headed in a trend that is concerning me in terms of student conduct, that we have had 18 nuisance parties that have been identified in the month of February, as well as citations that have been issued for adherence to emergency public health orders. This is not a period of time in which we can relax. We know that there have been some parties that have been reported, and we are going to continue to address those through our student conduct process when they get reported to us. When cases are referred to us, either through the public health authorities or through the Boulder Police Department, we will take action. It's important for us to do it. And as you can see, there are a number of students who are currently under interim exclusions because we've identified them as having engaged in unsafe behaviors. We don't want to be there, but it's important that we continue to do what's necessary to protect the community. On vaccines, Governor Polis had some very important information that came out last week that identifying what the phases were for vaccination across the state. Currently, the state is in phase 1B2, which means that all of the people in the prior phases have been eligible for vaccination and that they're working their way through. Currently, they're trying to complete the population of Coloradans age 65 to 69 and the K-12 educators and some people who are necessary for the continuity of state government. That phase is proceeding, and very shortly, we think we're going to be entering phase 1B3. 1B3 is a category for people who are age 60 and older, frontline essential workers in grocery and agriculture, and people aged 16 to 59 with 2 or more high-risk conditions. We'll be moving into that phase very shortly, and the county will begin vaccinating in that phase. What's really exciting, though, is that we have received a new prioritization, which is phase 1B4, which should be occurring in the next month or so. We don't know exactly when, because in order to move into phase 1B4, you have to get through 1B3. But there's a very significant call out in that, which is they have identified student-facing employees within higher education as those who would be prioritized in phase 1B4. What we've done is we've tried to identify who would be eligible within that phase, and those include our employees in housing, dining, facilities, transportation, safety and security, instructional faculty, including instructors, teaching assistant, GTPIs, and other personnel who are there providing instruction in an in-person format, researchers, as well as employees who have other locations that require in-person interaction with our student-facing population. And so we're really gratified that the governor was able to move higher education employees into that upcoming phase of vaccination. Very soon, we're going to be setting up a sign-up form, and information will be set out to the campus later today to be able to identify how faculty, staff, and students who would be eligible in these phases can sign up. This is really important. If you don't sign up for vaccination on the campus form that we're sending out, we're not going to know to be able to schedule an appointment for you once you become eligible. It's important to remember, though, that you may have the option of receiving the COVID-19 vaccination in other locations, such as pharmacies or in state and county sponsored vaccine clinics. If one of your providers offers you an opportunity to get vaccine away from the campus, please feel free to do so, and we're encouraging you to do that so that we can continue to work through our populations as well. After phase 1B4, phase 2 will begin. That's the general public phase. That's likely when a lot of our student population will be eligible. We're hoping that that will be in the next several months, and that we'll be in a position to, by the fall, have great large portions of our complete population vaccinated. From a vaccination standpoint, you can see that there have been thousands of doses administered throughout the county. Each day, more and more cases are being, or people are being identified for vaccine. And what you can see from the data is that really it's been focused on that population over the age of 70 or between 65 and 69 in accordance with those prioritization schedules. As we move through, though, we're going to see that there are going to be more and more people becoming eligible under the criteria, and we're going to see the numbers begin to have a greater distribution. So at this point in time on the campus itself, we've been able to fully vaccinate 265 individuals. Our staff is working to be able to scale up those capabilities as we begin to receive vaccine doses. Each week, though, we don't know exactly how many vaccine doses we're going to be getting, and that we remain dependent upon the state to be able to send those to us. As soon as we get those, we will be prioritizing them and making sure that we get them out to members of our community. And so this is good news. We appreciate all that you're doing to support this, and we look forward to being able to share more information with you today. With that, I'll turn it over to Provost Moore.
Thank you, Pat. I do want to remind everyone how important it is to routinely check the campus's COVID-19 vaccination webpage and to read all emails you receive on the vaccination process on campus. This is a very dynamic situation. Make sure when you receive information about the sign-up form for the vaccine, please review it carefully. As vaccine supplies increase, we will want to ensure as many in our community get vaccinated as possible. Again, right now we're highly dependent on supplies and flow of the vaccine, but once those issues begin to work themselves out, we want to get as many people vaccinated as we can, as quickly as we can. A couple of quick announcements on academic matters. We announced last week our plans for summer term. We will offer a combination of in-person, hybrid in-person, and remote courses for the summer 2021 term. In the summer of 2020, all courses were remote, and we saw an increase in enrollment from previous summer sessions. We will continue to meet the student demand for distance education in the summer. The priority for offering in-person courses this summer will be for classes that help undergraduate and graduate students advance and complete their degrees. Students can view the designated course modality when searching the summer class schedule. Also, a follow-up on last Wednesday's announcement are plans to move forward with a more comprehensive on-campus experience this fall. Based on the latest pandemic projections, anticipated vaccine availability, and uptake in our community, and following the recommendations of our faculty to minimize the spread of the virus, we hope to offer the majority of courses in person this coming fall. To allow our campus experts time to make recommendations for expanded classroom capacities, which will impact the fall 2021 schedule of classes, we have modified a few key fall registration dates. The fall 2021 schedule of classes and students' assigned enrollment dates will now be available on Monday, March 29th. This is a postponement of 3 weeks. Fall registration will begin for degree-seeking continuing students by assignment on Monday, April 5th. This is a postponement of 1 week. Summer 2021 registration dates are unaffected. The schedule of summer classes has already been posted and registration will still begin on Wednesday, March 3rd as planned. We have begun communicating these new deadlines to graduate and undergraduate students in Buff Portal and in today's edition of CU Boulder Today. Our faculty and academic staff have also received the information. Once again, we're optimistic and excited about fall semester and increasing significantly our in-person educational component. That all depends, of course, on vaccine availability and conditions next fall. In the meantime, progress demands that each of us continue to observe safety protocols on masks, social distancing, and hand washing. Get vaccinated. Be aware of new information on testing and vaccine availability and acting on that information. And now to talk more about vaccine safety, let me turn it over to Matt McQueen.
Great. Thank you, Russ, for that introduction. Let me see if I can get this sharing. Go. Okay, I just want to go through quickly to discuss some of the current science on what we know about primarily the 3 vaccines that have now received FDA emergency use authorization. And so in particular, just briefly talk about some methodology, discussion about the safety of the vaccines, and then finally, what's our evidence of the efficacy and whether or not they work. Some of the methodology here, I just want to quickly point out that, these are the 3 vaccines that have been approved, Johnson & Johnson, including the Pfizer and Moderna that use mRNA, are both designed to give the body sort of a blueprint, right, for your own body to actually generate the spike protein. Again, these spike proteins that are on the SARS-CoV-2 virus. The production of those spike proteins by your body, right, then initiates the immune system response. And that's the cascade that we're after, is trying to initiate the immune response without all of the other dangerous issues of getting sick with the actual virus through natural infection. I point this out with in terms of phases of clinical trials, just to, nothing's been skipped with the step towards approval. The phases that would undergo any sort of vaccine or drug development were taken, literally a year ago. They started phase 1 when they received the genetic sequence of the virus. And so the different phases as we go from phase 1, phase 2, phase 3, and now we're actually in phase 4, which is really sort of evaluating and studying the impact of the vaccines in the wild, right? So not in a controlled clinical trial, but actually how are they working? I point out here that throughout all of these steps, right, all of these studies through phase 1, 2, and 3, and even now, as we'll see, right, there's a big emphasis on safety. So they're looking for adverse effects. They're looking for effects that may last, within the sort of, immediate window of being vaccinated, and they're looking as long as a term as they can through the window we've got, right, in terms of the first doses being injected of these, going back about a year now in that phase 1, some of those phase 1 trials. So this is a graph. I just want to sort of demonstrate the 3 approved vaccines that we have: Pfizer, Moderna, and Johnson & Johnson. I'll refer to them as. This was, these were large clinical trials, 40,000, 27,000, 43,000 individuals. Very, I say, respectable representation from a variety of our populations, both within the United States, but also globally. Johnson & Johnson in particular had very robust trial enrollment in South Africa and Latin America, in addition to the United States. So we've got, the safety and the efficacy profile is really based upon a broad participant base. So are they safe? Well, again, so now, so if you're not someone who likes to be an early adopter, good news, there's already probably, I think now 62 million people who've received at least one dose of one of the approved vaccines at this point. I show some, just some of the statistics here on data that are coming from, again, this CDC vSafe for the vaccination tracker, which anyone can participate in after you've received a vaccine. And so again, you can see the demographics here. We have nearly 1.8 million Black individuals who've received the vaccine. 2.3 million Hispanic Latino individuals have received the vaccine now. Individuals are now, right, individually, but also through their doctors, tracing any kind of side effects. And this is what we're seeing from these millions and millions of data points. This is an example from the Pfizer, but this is true for both the Moderna and Johnson & Johnson, is that, common side effects include, injection site pain. You may feel tired, have a headache, you may have some muscle pain, fever, joint pain, chills, nausea, and swelling, right? Again, the relative percentage of that tends to vary significantly. The second dose does seem to be, if you're getting a 2-dose regimen, does seem to have more side effects than the first dose, as you can see here for a lot of these. And so really the conclusion, right, is, this is some of the information that you'll receive once you are eligible for the vaccine. They'll tell you what to look for. They'll tell you how to sign up for this to report any sort of side effects that you are having. But by and large, right, these, remarkably, with millions, tens of millions really worldwide now receiving the vaccine, we're seeing, I think, sort of very common vaccine side effects that we would see with the flu shot, other things like that. This was, but I want to emphasize that, despite the, the FDA EUA authorization here, as opposed to a full approval, right, the steps for safety, were not, really were not, no corners were cut in regard to safety. The mRNA and the DNA vectors do not change your DNA. There's nothing that goes on like that. These are, mRNA in particular is incredibly unstable, which is required for the cold chain. Once it gets in your body, right, it's sort of taken up by cells and quickly degrades. So again, these are safe, and right, do they work, right? So it's great that they're safe, but then are they actually going to protect us? Whether they work, right, I think about this in terms of whether they're preventing you becoming infected. Do they protect you from getting really, really sick if you were to be infected? And then finally, do they reduce transmission? So if I get infected, am I less likely to then transmit it to others unknowingly? Quickly on this, right, if we think about without a vaccine, which is where we've been up until, December of 2020, right, we've had the whole, with this particular virus, everybody from asymptomatic all the way up to the unfortunate consequences of hospitalizations and death. We can envision a particular vaccine. This is not anyone that's been approved, but just a vaccine that essentially shaves off the scary endpoints, right? And turns what would have been a very serious disease into a more moderate disease, moderate to a more mild, and so on. Then we've got another vaccine candidate that may do something like, right, reduce actually your likelihood of being infected, as well as shaving off those scary endpoints of disease. So here are the results from the trials for these 3 studies, looking at Pfizer, Moderna, and Johnson & Johnson, right? The one thing I really want to emphasize here is, right, the remarkable protection against hospitalizations and deaths in anyone who's received the active vaccine arm of the trial, right? These are numbers that I don't think anybody could have even, thought possible in the summer of last year of looking at these things, right? So these are remarkable protective vaccines. Now, the question is, right, can it protect against symptomatic infection, right? So again, what we see with the Johnson & Johnson is a little more of a convoluted story, because the Johnson & Johnson trial was deployed during what was the largest worldwide surge that we've had in areas that have had emerging variants, Brazil, South Africa in particular, right? But I want to point out protection against severe COVID-19, what they're seeing is the longer they look at Johnson & Johnson over time, the more protective and the more effective it tends to be, which is consistent with sort of vaccine effectiveness. The longer window you pull out of this, right, the more effective it then becomes. And again, Johnson & Johnson, shelf-stable, 1 dose, right? So this is a remarkable addition to the Moderna and the Pfizer that we've got. busy slide, I get it. Just take my word for it. The real world phase 4 data that we're seeing coming out of Israel in particular is nothing short of spectacular. The effectiveness, the protection, everything is showing as we'd hope. You can see this headline from an Israeli newspaper here that if everyone had shots, vaccines, we'd only need a few dozen virus beds, said one of the top Israeli docs on these vaccines. And you can see this in real time, right? Here's Israeli over 60s, right? In terms of hospitalizations, their hospitalization slope is dropping much, much faster than individuals 0 to 59. They are vaccinating aggressively over 60 starting in January. So we're seeing this actually work in the real world. Here's what's happening in our own country in the CDC report on cases erupting from nursing homes. And just to say, this is a trend. Now, again, there's been a downward trend overall after the surge, but we have never, since recording in the numbers like this in the pandemic, have reached this low of a point of our nursing home residents in terms of cases. So they're actually, we're seeing really strong early evidence that these are working through phase 4 investigations. Finally, do they prevent transmission? Johnson & Johnson was one of the few trials that actually looked at this directly. They came into some about 84% less likely to transmit, whether you're asymptomatic or otherwise, to other people. Other real world phase 4 data is coming in on this that confirm that sort of general number as well, that if you are vaccinated, you are less likely to be able to transmit it to other people. So even if you are the rare case that were to become infected, you are less likely to then transmit it to others, which is again key to breaking the transmission. So again, here's what we've got. We've really got the dream scenario with these vaccines. They reduce infections and they shave off the really scary endpoints in addition to reducing the transmissions. I think we're going to see a dramatic change in the course of this pandemic in the next couple of months in this country, in the UK and others, right, related to the effectiveness of these vaccines. Conclusion slide, and I'll leave it there, and I'll hand it over to Gloria to say a few words on vaccine, through the medical center perspective.
Thank you, Matt. So I am delighted to be here this afternoon to update you regarding medical services, some of the vaccine efforts here on campus and how we are supporting them. But I do want to start with promoting what we all have been saying here today, my #1 public health message that Matt shared eloquently and that I am just passionate about. And that is to highlight and emphasize how important it is to get the vaccine when and if you are able. It really is going to make the difference in our capacity to return to some sense of normalcy. So we know that all 3 of these vaccines are safe and effective at preventing serious illness from COVID-19. They are all safe and effective at preventing hospitalizations from COVID-19, and most importantly, they are safe and effective at preventing death from COVID-19. The J&J that just received EUA this weekend, 100% effective at preventing deaths. That's almost unheard of. So at Medical Services, we are really proud to be partnering with the state and Boulder County to be what's called a designated provider to our CU Boulder and local community. So what that means is that we can order and receive vaccine and administer it here on campus. I think the exciting news of this past week that Pat mentioned was Governor Polis's announcement Friday adding forward-facing higher education faculty and staff to this new phase 1B4. Our current estimates for eligibility and our capacity at Medical Services to get shots into arms for this phase of the distribution is the end of March. So it is not far off. And that 1B4 also includes individuals over 50 and individuals ages 16 to 49 who have one high-risk health condition. And if you're not familiar with the governor's vaccine distribution model, just go to colorado.edu COVID-19 to the webpage, and there is a link there to the actual distribution table. So at Medical Services, we have actually been vaccinating individuals on the campus community since the beginning of January. We are currently completing vaccination of individuals in phase 1A, phase 1B1, and 1B2. And our capacity to get shots into arms and move from one phase to the next depends on a couple of factors. The first, of course, is what phase the state is in the distribution model and the governor's directives. And then the second is the supply we receive. So we have not been immune to the recent delays due to weather and supply chain issues, like most of the designated providers within Boulder County, within the state of Colorado, and across the country. So probably the question many of you want an answer to is, when can I get my vaccine? So the fastest way for you to get a vaccine through CU is to complete the form that Pat mentioned that will be available, I believe, later today. It's a form and a questionnaire. We will then use the information obtained on that form to determine when you are eligible to receive the vaccine when it becomes available, and reach out to you to schedule an appointment. A question I have received from several individuals, especially after the EUA approval with J&J this weekend, is, now that we have 3 vaccines, do I have a choice? So the answer to that is no. As a participating provider, we honestly don't know from one week to the next how much vaccine we're going to receive, when the vaccine will arrive, and which vaccine we will actually receive. So as a participating provider, the medical services team is prepared to administer all 3. And of course, my hope is, whether it's Moderna or Pfizer or J&J, you just choose to get it, because with every dose we administer, we're all safer and closer to ending this pandemic. So we are really proud at Medical Services to be an option and a site to provide your COVID vaccine. You are not required to get it here. If I were you, I would sign up on as many sites as you are eligible to and take the first available appointment, because once again, remember, these vaccines are all safe and effective at preventing severe disease, hospitalization, and death. And finally, I will end with my number 2 public health message that I'm also very passionate about, and that is to remind you all to continue to follow public health guidance to keep yourself and our community safe. So mask up, wash your hands frequently, and continue to physically distance. I think the CDC director has said it best: we may be done with this virus, but this virus is not done with us. So be safe, and please continue to protect our herd. And I will turn it back over to Andrew.
Thank you so much. And thank you to all of our panelists today. If you have a question about your particular job and vaccine eligibility, we're going to direct you to please head over to Buff Info for more information and to ask that question. Also, a reminder, you will be getting an email if you're faculty, staff, or students with more information about vaccine eligibility with that sign-up form. Please be sure to check your colorado.edu email address later today. Now, we want to give all of you the maximum amount of time for your questions, so we will transition to the question and answer period of today's call. Again, if you have a question, please use that Q&A function at the bottom of your chat. We will start with a question here for Patrick O'Rourke. Will COVID vaccines be a yearly thing moving forward?
So we don't know the science fully on that one yet, and I would ask Matt if he could jump in. I anticipate that we're probably going to see vaccines that are going to be adaptive as the virus adapts as well, but we don't know the exact nature for how long they're going to be effective for and when the renewal is going to be. But we're anticipating that we're going to need to maintain this capability going forward to be able to make sure that we're protecting the population. Matt, do you want to jump in on that one?
Yeah, so, I think at this point, in terms of, how long immunity would last, the good news is that the current vaccines, the 3 that we have approved in the US and the AstraZeneca vaccine out of the UK, show robust T-cell immunity to all of the variants, meaning that it still has that really protective nature, protective from hospitalizations, protective from deaths, no matter the the variant. And that's just kind of the nature of T cells. They don't, they like to, they take sort of 3D pictures of what they're studying, and then they're ready to go with even slight changes in the virus sequence that come back. So the efficacy in terms of whether you might get sick may change. And at that point in the next 2 or 3 years, we may need a booster if there's enough drift in the variants. But at this point, I think it's too early to say it would be annual. I think that, there may need to be one more knockout punch for this current kind of wave, maybe towards the end of this year or early next year, calendar year. But that really depends on how fast and quickly we get this under control as a global community.
All right, thank you. Question for Gloria here. What recommendations are there for vaccine recipients who develop what people are calling COVID arm or enlarged lymph nodes?
Sure. So a couple of points here. So if you develop COVID arm, if your arm is sore after the injection, you might experience even some redness at the site of injection. The best recommendation is a cool, wet washcloth over the injection site. If your arm is a little sore, use it. Exercise that arm. And then, of course, if after a few days your symptoms aren't resolving, you should see a provider. Signs you would want to look for would be warmth, a hot arm, redness, and of course, any pain. In terms of lymph node enlargement, and oftentimes it will be under the arm, the axillary lymph node of the arm where you received the injection, that's just a very normal response that your body has to the vaccine. It actually shows that it is your immune system is activated, and that is good. Once again, if the lymph node doesn't go down within 2 to 4 weeks, you experience pain, then you should contact your provider.
Okay, thank you so much. Another question for Pat O'Rourke. Will staff members who work from home be included in vaccine phase 1B4?
So probably not, which is that for people who are working entirely remotely, whether that's faculty or staff, that is not within the distribution schedule that has been established by the state, which really is prioritizing those people who have student-facing roles, meaning that they're interacting with students in person. Now, it could be that because of other health-related conditions or age, somebody becomes available in 1B4, but the nature of the work would not result in any prioritization for people who are working in higher education, but doing it fully remotely.
All right, thank you. Another question for you, Pat. Would librarians be included in this definition of student-facing employees?
Librarians do fall within the definition of our faculty and instructional staff, so that those who are working in a student-facing capacity would be part of that 1B4 group.
Okay, and we'll stay right with you for another question here. I have a family member in 1B2 phase, this person says, who has still not been able to get vaccinated and is diabetic. When will these people be able to get the vaccine?
So somebody who is in phase 1B2, which we talked about earlier, were those people in the 65 to 69-year-old population, also includes people who are K-12 educators, other who are frontline, are currently eligible, but that our shipments that we receive for the university are for, that we're supposed to be using those for university affiliates. I would recommend that that person go to the Boulder County website, which gives a list of the places where the general public, assuming that the family member falls within that category, to be able to check for eligible sites.
Okay, wonderful. Question here for either Provost Moore or CO O'Rourke. Will adjunct faculty be included in this phase 1B4?
Russ, do you want to take that one? Mute.
Sorry, I'm on mute. yes, if adjunct faculty are truly student facing, then and they're doing so now, then they would fit into 1B4.
Okay, thank you. Question here. We have employees that work in community or that work with community college students that we bring to campus in the summer for a research experience for undergraduates. We're planning on a hybrid solution, but our staff may need to do regular on-site check-ins. My question is, would a researcher in this scenario qualify for the vaccine at 1B4? Again, I think, and Pat and Russ, feel free to chime in here. I think for specific questions, we're directing people at a certain point to move that question to Buff Info. Is that correct?
Yeah, I would. That's a question with enough specificity that I'm not comfortable saying, yeah, I'm sure that's within 1B4 or not within 1B4. Would be the type of question for a specific individual where I'd really be looking for people to go complete the form so that we can determine that eligibility based upon the nature of the duties.
Apologies, muted. A question here for Pat or for Laura Arroyo. Does phase 1B4 include student employees working in service points, such as dining in campus stores?
Laura, you want to jump in?
Yeah, absolutely. So currently we're definitely supporting our RAs and our student-facing staff that work in the residence hall due to their proximity to students. And what I would say is for any students that are in kind of a front-facing responsibility for their job, it'll be important to look at Buff Info for their specific designation for where they fall for vaccination. So definitely refer all students back to Buff Info for more information to talk about their specificity, but RAs for sure we're supporting.
All right, thank you so much. Question for Pat or for the medical experts. From a staff perspective, am I correct in understanding that 1B4 would only apply to staff working in person currently, not staff whose units have reorganized to work remotely for now?
Yeah, so as we're going through that, the people who are in 1B4 are people who currently have the duties that would be student facing. Obviously, if there are decisions being made that people are returning back to campus roles, that we need to evaluate that. But like I said earlier, if it's remote work currently, that wouldn't be something that would be prioritized, even if that work is normally student facing.
Okay, question here for Russ or Pat, very similar lines here. I'm a faculty member who works 100% remotely. Am I eligible for phase 1B4 or not until phase 2?
Russ, you want to grab that?
Yeah, I think COO O'Rourke addressed that one earlier. So if on the grounds of being 100% remote, the answer would be no, but there may be an age criterion that would qualify somebody to be participant in 1B4. So again, please go to Buff Info with your specific information, fill out the form, and we can get to the specifics of the temporal eligibility for the vaccination through phase 1B4.
All right. And another question for both Pat and Russ. Do you know when that sign up form for vaccines under stage 1B4 will be circulated? For whom will it be sent so we can keep an eye out for it? I think they mean to whom.
So that is something that we're hoping to have online as early as this afternoon. There will be an administrative e-memo that's coming out from me and Russ that will go to the entire university community by email.
Okay, so keep an eye out for more information coming forthcoming in the email inbox. Question here for Gloria. Could you please elaborate on how we should be completing the form if we anticipate our status changing? For example, if someone's just recently got pregnant, which could count as a high-risk condition.
Sure. So my recommendation would be you complete the form based on your current health status and condition. I do think, though, if I could just take a moment to talk about the pregnancy issue, because there are questions about that. So the short answer about whether or not you can receive the vaccine when you are pregnant is yes. So all COVID vaccines authorized by the FDA should not be withheld from pregnant individuals who choose to receive it or who are planning to get pregnant or trying to get pregnant. Having said that, the manufacturers of all the vaccines strongly recommend that women talk with their healthcare providers and their healthcare team to discuss their particular health history and factors that might be impacting their pregnancy. Just for some awareness, not to get too deep into the weeds with this, but the current national recommendations from ACOG, that's the American College of Obstetricians and Gynecologists, and then the Society for Maternal and Fetal Medicine recommend that, and this was prior to J&J getting its EUA approval, but that neither Pfizer nor Moderna should be withheld from pregnant women or individuals who choose to receive it. We know that COVID can be severe in pregnant women. The CDC includes pregnancy as a high-risk group for severe illness, with recent reports indicating that there's an increased use of ventilation and death with pregnancy and COVID. So I would fill out the form with your current health history and then discuss it with your provider.
Wonderful. And then I think Matt McQueen, you maybe wanted to clarify a little bit more about 1B4 and vaccine eligibility.
Yeah, I just saw another question pop up there. So I just don't want, the confusion. The 1B4 is quite large. A portion of 1B4 includes higher ed designations, but the other aspects of 1B4 involve dining, food service, restaurant workers, so on and so forth. So if we have students who work in those capacities, right, not necessarily student facing, which is part of the higher ed part of this, but if they just work at a restaurant, they are also eligible for 1B4. So there's also an occupational guidance there.
Okay, thank you. Another question for Pat, Russ, or student affairs professionals that we have on the call here. There are still a lot of people on campus, mostly students, not wearing masks, this person says. What are you doing to ensure compliance?
Yeah, so I think the question needs a little more clarity. So if people are not wearing masks in classrooms, that is an issue, and we would expect the frontline recommendation from the faculty member who has control of the classroom to either ask the student to get the mask on or to leave the class. And in terms of people walking around campus, we don't have mask patrols per se, but I think it's incumbent upon all of us as members of the community, if we see people not wearing masks where we think that presents a risk, then we should just, as a citizen of the campus community, ask them to put the mask on, just protect the herd. And I know some people find that awkward, but if we're in this as a community, I think we should get over that awkwardness and just, all pull together on this one. So it's a shared responsibility.
Okay. A question here for Gloria. What if you were truly allergic to the ingredients in 2 of the vaccines? How would one find out what the ingredients are in general in the vaccines?
So this is a great question, because really the only reason you shouldn't get vaccinated is if you are allergic to the ingredients in the vaccine, or if you're getting a 2-dose series, if you have a severe reaction to the first dose. But the CDC has a list of all the ingredients in Moderna, Pfizer, and J&J, and also all of the websites. So if you just Google Mrna vaccine and go to their website, you can find the ingredients that are in the vaccine located there.
All right, thank you. A question here for Russ. If a faculty member has an in-person class scheduled for summer session, does the provost recommend that they change the modality to remote, since attendance for summer remote classes was higher last summer? Would this better serve the student community? Quick question or quick answer right out of the gate.
Well, the quick answer is no. Please don't change the modality. we do have a robust set of online offerings. And I think that will certainly meet the needs of those students who can't or don't want to physically attend classes. But we also know there's a significant desire on the behalf of students to really have those students who are in Boulder County or who are still living in Boulder to have that in-person experience. So please don't change the modality. And I also think the variety that we can provide enhances the experience for all of our students.
Okay, thank you very much. Question for Gloria or Matt. I've received both doses of the Pfizer vaccine with no side effects. Did it work?
Yeah, so don't be alarmed if you feel just fine or have mild symptoms after you get the vaccine. Everyone's immune system is really different and is going to respond differently. I think it's comforting to know that half of the people who got vaccines in the studies had no side effects. So you are among a good group of individuals. We do know, however, that side effects in individuals who are 18 to 55 years old generally will experience more side effects than over 55.
Okay, interesting. Matt, anything to add there?
No, Gloria covered it. That was going to bring up the fact that in the trials that about half didn't have any side effects or reactions and yet still had protection. So,
all right. Another question here for Russ or Pat. What is CU doing in communities of color to encourage adoption of the vaccine and or increase access?
Yeah, so Boulder County Public Health, in cooperation with the state, are mounting a campaign targeted to our underrepresented communities to provide more information about the vaccines and to encourage the use of the vaccines. So since they're taking the lead, CU Boulder is actually trying to amplify those targeted communication efforts. And then I would also add that if folks are members of the CU Boulder community, we can certainly have consultation with our health professionals or with their own personal health professionals to zero in on any concerns that might be raised about the uptake of the vaccine.
All right, thank you. Question for Patrick O'Rourke here. Is campus going to supply vaccines for staff? Also, will any CU staff, faculty, or student be able to get the vaccine on or through campus, or just those folks already identified as student facing?
So let me make sure I get this right. Can you give me the question one more time, Andrew?
Sure. Is campus going to supply vaccines for staff? Also, will any CU staff, faculty, or student be able to get the vaccine on or through campus, or just those folks already identified as student facing? I think there are a couple pieces.
There's a couple questions there. So we are providing the vaccines without charge to the members of our community when they're eligible. The question is confused me just a little bit because we're not the ones who are supplying the vaccine. We receive the supply from the state, and then we have the obligation to be able to distribute it according to the standards that are created by the state. We have the capability to do that. We won't be charging people when they come in and get it. And as we move through the different phases, we'll keep expanding our capabilities to be able to offer it. So that as we move from phase 1B3 to 1B4, we'll be working to be able to provide that in our community. And then when we move into that phase 2 for the general population, we want to be able to make sure that we're providing that capability too as we receive shipments. But like I talked about earlier, people may be able to get the vaccine through other means, through their own providers, through community clinics, given that we're really dependent upon the shipments that we receive from the state. If you have the availability to get it somewhere else, we definitely would not tell you to wait for us. And we would actually encourage you to be able to get it if it's made available to you as a member of the community before it might be available through CU.
Okay, thank you. A question here for Gloria. How is CU providing targeted support and assistance for custodians to register for the vaccine? Not all custodians speak English, and not all have access to technologies.
So we have been working with the facilities to provide assistance to individuals for signing up for the vaccine and with the use of this new form. And there might be someone else on this call who could speak to whether or not that is available yet in other languages. I don't know the answer to that.
Gloria, I know that they are working on that currently, as in today over in Human Resources, to be able to make sure that we can provide the vaccine eligibility across our population on an equitable basis.
Okay, thank you to both of you. And a question for Gloria or Matt. Can you talk a little bit about the differences between the Johnson & Johnson vaccine versus the mRNA vaccines for people with compromised immune systems?
That's a really good question. So the one thing to remember, all three of these candidates now that are approved, none of them are, a live virus or attenuated live virus, which may be, what you'd think of with a traditional vaccine. So under all three emergency use authorizations for these three vaccines, these are all recommended broadly for, individuals of, with different types of conditions, including individuals who are undergoing treatment for autoimmune conditions, or who may be, their treatment themselves may be suppressing the immune system. So essentially, right, these are just the instructions. These are not the actual bits of virus that would rev up an immune system in a deleterious way if you had some dysfunction in your kind of host immune system. So these three are all actually really good candidates in this for this particular type of scenario.
Okay. Another question for Pat or Gloria here. Without knowing the upcoming shipments of the vaccine week to week, how is CU ensuring that one receives the second dose on time?
I'll let Gloria take that.
Sure. So when you come to the vaccine clinic and get your first dose, we automatically schedule you for your second dose. So if it's Pfizer, it's 21 days out. If it's Moderna, it's 28 days out. And then when we actually complete the paperwork and the order with the state online, we are indicating on that order each week or a week before whether we are ordering first or second doses. So far, we have, except for 1 week when we had the bad snowstorms, we have received the vaccine for the second doses. If we had individual schedules and we didn't receive it, then we would just have to delay their second dose until we did receive it. But I think it's important to note that it is really anticipated that in the not too far distant future, there is going to be more vaccine available than there are going to be arms to put it into. So there is going to become a natural cadence, and we are already starting to see that with our orders with the state. So I think we got off to a slow start, but things are picking up and moving forward nicely.
All right. This will be our last question for today, potentially for Pat O'Rourke or another expert on the call. Will the vaccine be required to attend and or do contract work on the CU Boulder campus?
So that's a question that I haven't thought about yet, to be honest, which is that currently, just like we've discussed before, that the vaccines are currently available only under an emergency use authorization. And so at this point in time, we're not mandating that CU affiliates, students, faculty, and staff are required to take vaccine while it remains under that emergency use authorization. We're definitely encouraging it. But that with respect to contractors, I have not had discussions about requiring them to take vaccine as a condition to being able to work on the campus. So at the moment, that's not part of what we're requiring. And I just had one last thought, which is, as you can tell from the questions today, This is a pretty rapidly evolving landscape that we've had. We just got the new guidance from the governor's office last week that made some of our employees eligible, changing the criteria throughout the state. We're working as quickly as we can and to be able to adapt to that. As Matt talked about, it's really exciting that some of the new vaccines are coming online, and there's just a lot of balls in the air. But this is all good news. These are the right type of problems to have. And we'd ask you to be patient with us as we are trying to get the logistics figure out, to be able to work through our populations, to be able to do the right thing. As I showed in some of my slides earlier, the projections are headed in the right direction. What we're seeing in our community is headed in the right direction, but it's not going to be perfect, and we're going to have some stumbles along the way. Please be patient. Let us know when you have questions. We'll do our best to answer them. But we're excited about what we're hearing, recognizing that there's a lot we still have to do.
Absolutely. Thank you so much. And thank you again to all of our panelists for providing a lot of great information today. Again, a quick clarification there for the specific jobs. We know a lot of people have questions. Is my job count in that 1B4 phase? And again, we encourage you to keep an eye out for more information via your colorado.edu email address. There should be more information in your inbox this afternoon. And again, we do ask for patience as we sort out a lot of the details of this very positive development. And again, we want to advise everyone that we are taking a slightly different approach to our weekly webinars this semester. We're alternating between faculty and staff campus Q&A sessions and student and family campus Q&A sessions. Next week on Tuesday, March 9th, the campus Q&A will focus on staff and faculty. The next student and family campus Q&A will be the following week on March 16th. These updates will occur on a weekly basis throughout the spring semester from noon to 1 p.m. Mountain Time, with the last webinar scheduled for Tuesday, April 27th. If you have more questions or you'd like to see additional information, you can do so by visiting our COVID-19 website. Again, that's colorado.edu/COVID-19. There you can find a chat on the bottom right-hand side where you can ask questions. Boulder County Public Health is also hosting community briefings this year. Those are every other Wednesday at 3:30 p.m. Boulder County Public Health's agenda at those meetings is to provide updates from Boulder County Public Health leadership, provide updates from public health officials on current topics, including vaccinations, testing, and data, as well as updates from other local partners. Lastly, the City of Boulder does a once-a-month briefing. That's every third Thursday of every month. Those are from 3 to 4 p.m. Mountain Time. Thank you all again for joining us today. We will now end today's call.